I realized after last week that I can never ever come fresh for the shower for the podcast because I was like, holy freaking wet dog. Like,
Oh
what the hell was
no.
I thinking last week with that? Yeah, I know every time I was trying to like get a screenshot, for Instagram or whatever,
Uh-huh.
and every single one I was like, oh, Lordy, we should have taken a blow dry to that hair just
That's
for a
funny.
minute.
I thought you looked fine, or I would have said
No,
something before I started recording. I'd be like, girl, you want to like readjust.
oof,
I
yeah,
unfortunately I have a patient at 11. So
it's okay. It's not
um
unfortunate.
well, and it's a good thing.
Yeah.
I'm slammed this week because I
So
had
are these like referrals coming to you like from you or from other like your like people like me just referring people to you and stuff?
9 out of 10, 9 out of every 10 of my patients are referrals from other patients. Um,
Yeah.
I get a lot of bodybuilders. Like I have a lot
Yeah.
of coaches that I have relationships with that refer to me. But I get a lot of weight loss people too. Like they are on their GLP and they're feeling and looking great. And then I get a ton of people on hormones.
Hmm.
I think outside of the owner of the company, I have more hormone patients than anybody else.
Yeah. I mean, the thing of it is like there really is, and I see this in my salon, regular practitioners and doctors, even like OBGYNs, are just not versed in hormone health. Like they just don't get it. And like 90% of, I mean, I've given your name, I don't know to how many people because I'm just like, you're not going to get the answers you need from your doctor. I'm sorry, you're not. They don't know what to look for. They're not
No,
trained
I
in
don't.
it. Like, yeah.
I get
Mm,
so many people that were told their labs were normal, and then I look
yeah.
at them and testosterone is 6, I'm talking about female,
Mhm.
and estrogen's 300. And I'm
Right.
like, no, this isn't normal. Like,
And they have no clue. And even if and even a lot of them, like, because I work women every single day, and they're literally feeling like shit. They're so tired. There's every single thing that they're saying is like, you need blood work immediately. And they
hmm
are just like, they don't even know, like, how can I get blood work? Who can I, like, like, should I
yeah.
ask my doctor? And then when you start to talk to them about hormones, they're so like old school, like, oh my God, you can't take hormones, like
You're gonna
one
get cancer.
cancer. Yeah,
No,
yeah.
there's actually research studies, and this is for the audience because I know you probably know this.
Hmm.
There are research studies that have admitted that they fear-mongered us into hormone replacement,
Hmm.
or into not receiving hormone replacement. And one of the things I think I really fell in love with hormone management when I myself went through a lot of issues. We talked about it
Yeah.
in I think one of the first episodes. But when I had my ovaries taken out, luckily I was already in this space, but nobody talked to me about how I was going to hit menopause within 2 or 3 days. Like I was 2 or 3 days after surgery, I was having hot flashes. And
Wow.
I was like, that's so sad because men
But
get a
your doctor
vasectomy.
that removed your ovaries didn't talk
No
about what
conversation, no conversation about
that's
how it would
kind of
impact
weird.
my hormones. Um, and I still had some estrogen because the pituitary gland is still intact, right? But
Hmm.
a lot of your hormones are produced by the ovaries. And
Yeah.
so, anyway, luckily I knew what I was doing. I already had estrogen ordered on its way and I was already on progesterone. But yeah, I was
Yeah.
I was like, wow, I honestly thought it would just trickle down slowly, but no, my system tanked like really
Yeah.
quick.
And that's
And
you, like you are in the medical field yourself, and you were seeing a doctor to have your over, and even still, you didn't have all the information you needed. So just a average woman, like soccer mom,
you don't know what
going
you
through
don't know.
perimenopause,
Yeah.
like, and they are going to like their OBGYN, that's like probably like my OBGYN's like a 75-year-old guy,
hmm
Like they don't know, they don't have the knowledge, and so they don't either they say old information or whatever.
Yeah, it's really
Um,
sad. And then I get a lot of people too, especially men, they'll have
mhm,
their hormones tested and they don't check estrogen. And then they're
mhm,
putting them on estrogen blockers, which are not good for us at all.
mhm.
They should only be used when needed. And a lot of men actually don't need estrogen blockers. Like it's more enclomiphene and HCG that drives up estrogen than it does testosterone therapy. And some men do. Some men are naturally more inclined to that conversion than others. But a lot of men are being over AI'd.
Hmm.
And
Do
it's,
you think that that's happening because other parts of their health are out of whack and that they're not addressing those issues? So it's just getting like, is it overproduct? Like, if they're having higher estrogen, is that because they are overweight or inactive?
in some cases, like alcohol can drive up estrogen in
Mhm.
men, inactivity, fat cells. But a lot of these guys too are they're just wanting to optimize their health or they're younger,
Hmm.
and I think they have this fear of getting like gyno is what it is,
Yeah.
and they're over AIing themselves. And so you have to do some education of like estrogen is anabolic. Like you actually need it to build muscle and it preserves bone density. It's going to preserve your hair follicles. Like it's got a lot of health benefits. And for women, it drives our sex drive a lot more than we want to admit. We want to say, oh, we need testosterone. No, honey, it's your estrogen.
Hmm.
Um, and so, I think a lot of it's just misinformation and fear. And also, like a lot of times, gyno is driven by prolactin, not estrogen. And you treat high prolactin by treating vitamin D deficiency. So,
Yeah.
9 out of 10 people are vitamin D deficient. And so, a
And
lot
then
of
that's not
times,
even being checked.
yeah, a
So
lot of
it's
times
just
you
like,
don't
oh,
even need medications, you need supplements,
yeah.
and vitamins and sunlight. So,
Yeah.
it's
And
really
that's
a
the
lot of
thing, a lot
misinformation.
of, yeah, like a lot of practitioners just don't understand all of that. And same thing, I mean, while we're on the topic too, I think a big misconception that I hear a lot, is women with testosterone replacement, even though, yes, we need estrogen and progesterone, but like a level, like you said, 6 in one of your female clients, like that's just not normal. And that's like women need testosterone. I think women automatically think like the gen mass population probably think that, oh my God, testosterone means like I'm going to turn into a man.
Well, I see a lot of the reverse too, where I'll get people from their OB and their OB's been letting them ride with a 200 level.
And a female?
Hmm.
Wow. Hmm.
And
Wow.
I'm like, you should not be over 100. Like, I'll let my athletes run up to 130 if you're
Yeah.
not having side effects, like andronization side effects. And because, like, I like my level around 125,
Hmm.
you know? Um,
As
but
a professional athlete
as
trying
an
to build
athlete,
muscle. Yeah.
my soccer moms don't need that level.
Right.
I
Exactly.
typically aim to get them 50 to 100. Now, most women feel best around 75 to 100.
Hmm.
Um, and I will let them ride a little higher if they're insistent that they're still having symptoms or whatever. But usually that's where you treat the patient, not the number. But at that point, I'm getting very honest with them. I'm like, listen, there's no reason that you need this. Like, there's something
Right.
else going on if we're treating tests and you're not getting the benefits. Like, how are you sleeping? You
Hmm.
know? Um,
Right. Now, are this women that are like having that high of a level of testosterone? Are these other athletes? Are these primarily athletes you're working with, or those are just like regular
just women
lifestyle
that come from
people?
their OBGYNs because they're not being
What in the
listened to.
world? What is
Or
causing a testosterone level at that
And
level?
also
I don't
like
know.
pellets are awful
Yeah.
because like and I use this example a lot of times too, like even people that have like defibrillators and ICDs, some people's batteries will fade quicker than others because our body chemistry will break down the battery quicker. Same thing with pellets. You have no control over the release of them and you can't take them
Right.
out. So a lot of people get bolused with these hormones and like I've had people with come to me 6 months after their last pellets and they still have testosterone levels in the 200s. And I'm
Wow.
like, that's not healthy though.
Do
Like
you
we
think
have to
that
check
the
your
majority of
cholesterol.
doctors are prescribing like pellet therapy for testosterone replacement as
Yeah,
opposed to like creams
they're
and
putting
injections?
a lot of them don't do oral or injectable hormones.
Yeah.
Like with
Uh-huh.
estrogen, they will only do like vaginal creams, which is ridiculous.
Hmm.
Um, I try to, and I understand why because of the fear, but at the same time, progesterone protects us against estrogen's negative benefits. I mean, negative impacts, right? And so, and the cancer risk is literally like 1 in 1,000. It's not high at
Hmm.
all. And that's usually in people that have been in menopause for over 5 years. And so, or over 65. So the risk population is not the people that are actually treating their hormones, it's people that have well past the menopausal age, and we need to just deal with it. But it's, at
Yeah.
that point, you just kind of let them have a little bit low estrogen and you support them with other things for their bone and hair. But um, my cats are crackheads. Um, and so I've lost my train of thought. I'm
Yeah,
so
no,
tired.
but I totally, what you're saying makes sense. And I feel like when you explain it like that and it's common sense, and I feel like the everyday like lifestyle person that needs your help is somebody who, um, they are trusting whatever their doctor is going to say, but they also understand the concept of like everybody's body is going to metabolize something. I mean, I think a lot of these women are getting Botox, so they understand that like Botox in them is going to last differently than Botox in somebody else.
I
So
know.
somebody
I
may
have to
get a
be
month,
dosed like a
the
man
same.
because of my metabolism. Like I'm always like, no, baby,
Exactly.
like you need to put like 30 units right here. Like I promise.
Right.
Like I actually got 100 units in my forehead once and I could still move it.
Oh,
So
wow.
yeah,
My God.
I do the same with anesthesia. Like I have to take more than most people,
Yeah. And
which is
so it
weird.
just makes sense that like everybody is going to have, different points like that. And that's why the pellets to me, it's just like, it's like if they could understand that there's a better way. I think that a lot of people, I'm surprised at the amount of people, especially now that we've gotten more into the peptides, are scared of injections.
It's coming around for sure. I
Yeah.
think the most of the fear that I get is around estrogen therapy, but I try to
Hmm.
explain to them, I'm like, we don't overshoot you. You know what I mean? Like
Hmm.
you take the minimal effective dose. And at the end of the day, like again, reverting back, I remembered my thought. Creams are so, again, with the same absorption as pellets. Like the absorption through your skin barrier is crap.
Right.
Um, it's going to do a lot better. And I have a few people that have like I've done oral estrogen and their body doesn't absorb it, because of the gut acid or whatever. So I put them on injectable estrogen, but I don't revert to that first. I usually, because it's harder to dose.
How long do you, I feel like this is so great because I get questions about this all the time because people know this is my space. So, how long do you take before you gauge like like a pellet, I think is like typically like 3 months or something like that it's in for. How long do you want blood work again to gauge if your therapy is where it needs to be
6 to 8 weeks.
Okay.
You get the maximum benefit after 3 months, but usually I would check them a little bit earlier, especially my women, because I want to make sure we're in healthy ranges. Or if they start having any side effects, like
Mm-hmm.
I had one lady, she's like, my boobs are tender. Nope, let's check
Mm-hmm.
labs. Estrogen's too high. Um,
Okay.
or if there's any like, if they just don't feel right,
Yeah.
or if they're still having side effects that they had of low estrogen, I will recheck them. And
Okay.
so I will recheck labs every 6 to 8 weeks until we're stable. And then every 3 to 6 months, I'm fine with. And the longer we're stable, the more I'm willing to push out the blood work. For men, 6 months, 12 months. But again, I always like to recheck labs 6 to 8 weeks after starting therapy on a man because I have to
Mhm.
check their estrogen. And I give them the option. We can start you off with the test with an estrogen blocker mixed in. And then if we are blocking too much estrogen, we take it out and we just put test sip in, or vice versa. We can start you without the estrogen blocker and see if you actually need it in 6 to 8 weeks. And if so, we can do the conversion. And then I give them like, what side effects would you rather deal with? Because if estrogen gets too
Mhm.
low, you're going to have joint pain and you're going to be a little irritable. If estrogen gets too high, you might have some anxiety and there's a risk of gyno. But the
Mhm.
gyno like risk with a little bit of a high estrogen's really insignificant, but
Mhm.
sometimes it's not reversible, so you always try to avoid it.
Yeah.
Because sometimes you get it, don't go away.
Yeah.
Um, so But yeah,
Okay.
I love this stuff. And so that is one thing my patients do get with me that I think a lot of people don't get, and that's the education component with it. I mean, part of my job with Elevis is to educate the providers and other clinics. So it's kind of like teach them to fish instead of just giving them the food. And so
Right.
like I'm trying to
Absolutely.
train, like I'm doing a education today on GLPs and stacking them with other peptides to
Mhm.
maximize results and to
Mhm.
maintain muscle and all of that, and going over the difference in like cargolintide versus, the other three GLPs. So,
And actually, while you're on that topic, like that's probably like optimizing your hormones is probably like priority over a GLP because especially if you're trying to maintain lean mass as a woman and your hormones in a place where you're losing muscle, you're you're beating a dead horse. You're, I don't even know what the analogy is, but you're like working against yourself if you're putting in a GLP and then you're also have no testosterone
well, I
or
told them,
whatever.
I'm like, I always like to start with labs because that way we can get any barriers out of the way. No, correcting your hormones is not going to make you lose 100 pounds. It's not going to
Hmm.
work that way, but it will get any barrier out of the way.
Yeah.
Um,
And all of those foundational things are so important. Like I don't think either one of us can stress like how because you can't do all the other things you need if your hormones are not in place and that's going to make the GLP less effective. So it's like
mhm.
why spend all this money if you're not sleeping?
Yeah.
if your thyroid is not optimized, right? If you can't work out because you don't
And
have any energy.
I see a lot of people that come to me and they've basically gotten into adrenal fatigue. And it's more of, okay, well, why don't we do a GH peptide to reset the pituitary gland, support the adrenals? And I told them, I'm like, it's counterproductive to everything that you're ever going to have been told in the past, but we're going to pull back on activity. We're going to
Hmm.
rest as much as possible. We're going to pull out caffeine. We're going to slowly increase food to get you to a healthy metabolism. And then we can start. I was like, but we have to, I'm
Is this
telling
like prep athletes coming out of prep, or is this just again lifestyle people?
lifestyle people that,
Wow.
it's a lot more times than often it's women and
Hmm.
they have chronically dieted themselves.
Yeah.
And they come to me and they're like, I'm only eating 900 calories a day. I don't know why I'm not losing weight. Well, that is why you're not losing weight. You are
Exactly.
underfeeding your metabolism. And now we have adrenal gland stress from over dieting and overworking out. So nothing I throw at you is going to fix that until we fix the problem. But
Hmm.
this is a very frustrating, time-consuming process. It's going to take 3 months to reset you, and then I need you to maintain there for 3 months before we even
Right.
talk about trying to cut. And so, like, that's really like a lot of those clients don't stick with me
Right.
because that's not what they want to hear. They
But
want
if they
something quick.
would, the results would be 100 million times.
Yeah.
Yeah, like it's just
But
crazy. It's like you're like, please just trust the process.
it's not about, throwing drugs at people. You got to fix the root cause.
Yeah. I think
And
about like
sometimes,
if a house, like the structure of the house is like completely falling apart, but then you go in and like do you paint on it. Like the structure, the house is still gonna fucking fall
yeah,
apart,
yeah.
and it's not gonna look that good. It's the same thing like without like, when I've talked a little bit about my Instagram of like people taking a lot of my clients are taking GLPs and things like that, and they're still not working out.
Mhm.
They're just starving themselves or trying to eat one meal a day or snack throughout the day or whatever. And they may lose a little bit of weight, but then they do not look good. Like that's where they have literally no muscle tone. Like it's just not going to work until you put the foundations in place.
Yeah. Yeah. And then,
I think also another thing for people to understand about you is how easy it is to work like with someone like you, where it's just like you're so quick to respond. And when you do need blood work, like this, you call in the lab, you go to LabCorp, you go
yeah.
in, they already have the labs. Like you don't even have to bring anything,
Mm-mm.
and you're there for like 10 minutes and you're done. Like it is
Super
literally, you
easy.
don't have to go to your doctor's office, you don't need a prescription, you don't need all this crazy shit. Like the LabCorp's literally like 7 minutes from my house. I show up as the first person there. I don't even do make an appointment, and then you get the results. Like we don't even have to worry about you getting the result, like how to get them to you. So it's pretty much could not be any easier.
Yeah.
So.
It is a very low maintenance company, which I like, and I tell my patients too, I'm like, you have basically access to my cell phone. So
Hmm.
I'm very responsive. The only day I don't reply is Sunday, and that's just because I don't
Yeah.
look at my phone on Sundays. But while we're talking about weight loss and stuff, I want to talk about BAM 15 because we just got it.
Hmm.
Um, and I think it's really cool. So, DNP as a mitochondrial uncoupler got a really bad rap in bodybuilding. Um, again, like a cheat code thing, overheats the body, basically induces a fever. Fever melts fat because your body's having to rev up to burn.
Hmm.
Um, rev up and more energy expenditure, more calorie expenditure, etc. So BAM 15 is also a mitochondrial uncoupler, but it's more selective, so you don't have the risk of overheating. The problem with DNP in the studies, because people were losing so much weight, people started abusing it and they would literally die of a
Right.
heat stroke from inside out. And you
Yeah.
can't bring internal body temperature down even with an ice bath. And
Right.
so this
I
is a
think
lot
like a
more,
max, like a usual dose is like 200 milligrams a day
it's
for
like
an open bodybuilder or something like
Yeah, it's like
that. Is it?
micrograms. And like
Yeah.
when I'm telling you, like for all of those, if you do get DNP anywhere, get a gram scale because if that is off by 100 grams, you're going to overheat. Like you have to weigh out each individual capsule. Like get empty capsules and like measure it and weigh it because I have gotten it before and it's been anywhere from 200 to 400 in one capsule. So
Hmm.
you have to measure it to make sure it's accurate.
Right.
But there are
But
better
when you
things
look
out
on
there
the
now.
internet, there's like stories of like, I think there was one story of a girl, like a European girl who took like 1,000 milligrams
Yeah,
or
they're
or
way
some shit like that
overdosing.
and like overdosed herself.
It's actually like this is not medical advice. Disclaimer.
Oh, yes.
Um,
This is
nothing we
our
say is actually
experience,
medical
right?
advice. We need to
Not
put a
suggestion,
disclaimer on
just
this.
experience. Yeah. I will say I
Um,
do have personal experience with DMP. And it was it worked.
I
It
mean, you look
worked. I
like a
lost weight.
watery bag of dicks while you take
Yeah.
it, but then you'd come off of it and you drop 10 pounds of water.
Well,
I've taken it before too, but it turns out it was my adrenal glands that needed fixing and not that I
yeah,
just couldn't lose weight. But BAM is a lot more selective, okay?
yeah,
And it's pharmaceutically dosed. It's not something that you get out of a bomb. Um,
right.
and
That's why I
so
do think we're going to see, we're probably going to see less, even like the old school coaches aren't really using
yeah,
like DNP that
I'm
much
gonna
anymore
test
now.
drive it because
Okay.
I like to test drive things before I prescribe it to my patients, just because I like to
BAM is an
know
oral or an injectable?
it's oral.
Okay.
So helps burn fat, more energy. So basically, your body doesn't produce as much ATP. It's going to use more of your food for energy, and it's going to
Hmm.
release heat. So thermogenesis helps body break down fat, use more calories, and improves metabolism. So also helps with insulin effectiveness in the body, liver health. It protects muscle, which is a really good thing. It targets fat, keeps the muscle safe, and also can reduce inflammation. It's been shown to reduce inflammation linked to obesity, insulin problems, and heart disease. And by improving the mitochondrial structure and reducing cell damage, it can be anti-aging. So, how does it compare to SLU, right? BAM uncouples the mitochondria. SLU signals the cells to store and use energy more effectively. So, your SLU is not going to disable the mitochondria or leak the protons across like BAM will. It's just supporting the mitochondrial function. You cannot take these together,
You can't take BAM and SLU together.
not together. Now you can,
When would be the case for one over the other?
it's one today, the other tomorrow.
Oh,
You do
gotcha.
them every other day, and you
Okay.
can,
So you're
that's how they're
cycling them.
best. That's how they're best used. But taking them on the same day can cause mitochondrial damage.
Okay.
So you want to either, and again, I think SLU is more slow acting because it's just making the body more efficient, whereas BAM is going to be more quick acting. Um,
Did you lower your dose of SLU when you're taking it, if you take it in conjunction with BAM?
that's something I'll have to tell you. So I
Yeah.
don't take a super high dose of SLU anyway. I
Because
only
I
take
feel like
400
people are
mics.
just like what we're hearing now, especially now that have peptides, is like people are really taking pretty high doses of the SLU now. So especially some of
Way
the
too
big
high.
boys.
Should not be over
So
1 milligram.
mhm.
Because it is a beta receptor, right? Beta receptors in the heart and lungs. Gotta be careful. Um, so BAM increases thermogenesis by directly burning fat and keeping muscle safe. SLU reduces fat storage and improves energy use, which may lead to slower, more steady fat loss. Both improve insulin sensitivity and glucose control. BAM does this by burning more energy and reducing oxidative stress, while SLU mainly works through cell signaling pathways. Both protect the liver from fat buildup and inflammation. Um, BAM is safer than older uncouplers like DNP. And
What's the
SLU,
dosing on BAM usually?
I think ours is, hold on, let me look it up. I want to say it's 50 milligrams, but for some reason, I want to double check, make sure it's not
Mhm.
micrograms. I put it under peptides, I think, because I add all of our stuff to the system. 50 milligrams. Yeah.
Hmm.
And obviously, this is not one of those things that you want to like continue to increase the dose because it does heat you up. So you don't want to get too hot.
Yeah.
Um,
And so would you primarily say that these are for like athletes in prep or it two questions, sorry, but would you say this is primarily for like athletes or someone in an actual like calorie deficit trying to actively lose weight, or is this somebody good like for maintenance to cycle it, or what do you think like timing on this?
I would after I try it, will
Hmm.
determine how I answer that
Hmm.
question. Because
Okay.
a lot of things, you can read about them all day long, but in clinical practice, it's a little different.
Yeah.
One, I want to see how I feel. I want to see if I get the same look that you get on DNP. Because if it makes you super watery and warm, normal people aren't going to want to take this.
Hmm.
Um, Now, bodybuilders are different, right? I do
Hmm.
think that I am trying it on one of my sponsored athletes as well. We're going
Hmm.
to try it and see how it goes, especially like in an off season where we're not interfering with prep, um, which is when I usually like to try things out
Hmm.
so that we don't mess up anybody's prep. Like, okay, if we're going to try something, let's assess tolerance in an off season, and then we know how it works for you, we know how you respond, and we're not interfering with the prep. But I want to try it first, get a gauge for what it actually feels like, what side effects I may experience. Because usually, if someone's going to get side effects, I'm going to get them. Um,
Oh,
so it gives
really?
me, yeah, I'm very sensitive to things. So it gives me an idea, and if it actually works. which I assume it
Yeah.
would. Anything that increases thermogenesis is going to work. Um, so
Would you suggest these in conjunction, since I guess since you're doing a little talk on them anyways, with GLP, like
yeah,
these different fat losses
yeah, I think especially
supplements?
for people that have like plateaued, because the GLPs have very, very, very little interactions with anything. Like they're very
Okay.
safe.
Hmm.
And it works on a completely different pathway, right? And so, and there was a recent study that just came out. I posted it on my story about how GLPs are correcting hormonal imbalances. And I
Yeah.
think I mentioned that it works on the kisspeptin hormone. So that's
Hmm.
why is it corrects the pituitary axis. But it's also why these people get pregnant on them. And I always ask people
Hmm.
if they're on birth control because I'm like, don't get mad at me if you get
Yep.
pregnant on a GLP
Yeah.
because you
Yeah.
will.
Yeah.
um,
And they're
but
losing weight and they're sexier and all of the things. So,
yeah, but just the way
yeah.
that it actually like it improves ovarian function. So
Yeah.
it's very interesting. But
When are you starting your BAM cycle?
I ordered it, so whenever it gets here, I'm just gonna try it for a month because I
Next week, you're
obviously,
gonna be like falling asleep and like sweating your ass off on next
right.
week.
I'm always nervous to try things too.
Yeah.
So we'll see. And I need to make sure Johnny's on board because I don't like
Yeah.
throwing things in without letting him know. But before we're not gonna get cut off, but I have 15 minutes. But I do want to talk
Hmm.
about Hurricane
Hmm.
Pro.
I would
Your
just like
girl
to say
Tessa looked so
my
good.
prediction was correct, I
And
will
then
say.
I want to talk a little bit about, let me pull up Prague's.
I just love, I cannot pronounce her last name, but her first name's Jennifer. I think she is just,
Yeah,
I
the
love her
German.
shape. Yeah, shape is just, I
I
love it.
don't know that I have her winning Prague.
Hmm.
Um, we've got some really good.
Honestly, I don't even know who else, like who the
There's
heavy hitters are.
36 girls.
Yeah, I did see that. I mean, I feel like so many of the shows have been like that this year, though. Like over 30 figure athletes, which is like great,
I think
phenomenal.
it is great. Yeah, there's a ton
Yeah.
of women doing figure.
Hmm.
Um,
But
well,
I am so happy for Tessa. We talked a lot this prep, her and I, and both of us were, really kind of struggling with, as you know, like not only working full time, but a lot of our work being in a vehicle and having to be in a car commuting, which adds not only working, but then that layer of difficulty. So, you know, just kind of like talking about the layer that adds to a prep. And I'm really excited to have her on here to talk because I know we'll get more into that, like working and being a bodybuilder. And
right.
so many people don't understand like how expensive this sport is and that we, even as pros, you pretty much don't get paid and you're gonna need to have some type of income, whether that be a full-time job or what. So I'm just really proud of Tessa because not only is she like an Olympian now, but also like a full-time health worker, which is probably one of the hardest like fields that you could possibly be in while being a bodybuilder.
Yeah.
So just good for freaking her.
Yeah, I love that for her. All right, let me
Tessa and
see.
I competed together. The first show that she won, I actually took second place to her, and we became friends at that show. And then as soon as I saw her, I was like, well, you're going to be an Olympian one day. I mean, she just had the shape, everything was, and so because I took second place, I was like, I'm going to go to Upstate. There was a show like 2 weeks later, and I was like, okay, I'm going to go. Oh, hello.
I'm here.
Oh, I lost you for a second.
I was pulling up these.
Oh, there we go. So anyways, because I took second place, I was like, let me go to Upstate and do that show. So I'm at the registration and I walk out into the courtyard and Tessa is sitting there eating her food. And I'm like, son of a bitch. Because I knew she was there. She was back to do another show the next weekend. And of course I lost to her again. Um, but I mean, if anyone to lose to, you know what I mean? Pretty much anybody would lose to
No,
her.
she's
She is
definitely balanced
incredible.
herself out. Like
Yeah.
her X frame
Yeah.
is so much better than it was. She looks incredible. And then we talked about Anna Boren. She
Mm-hmm.
won Atlanta Pro and was like fourth call outs at the Olympia. So what's interesting to me is you have oh my God, Mar what's her name?
I do not know her name.
I screenshotted the placing so that I could remember.
Uh-huh. Oh,
Manuela.
yeah.
And she was top 10 Olympian. Um And it was her pro rookie season, I
Oh,
believe. And so,
wow.
but you have her place much higher at the Olympia than Anna, and then you have Anna place in second against her the very next weekend. And so I think that there's a big discrepancy in what are rewarding
Hmm.
at pro shows versus the Olympia. Sandy
Hmm.
made a huge statement by prioritizing structure over size. But I
Yeah.
think
Was
we are
Sandy the head judge at the Hurricane Pro?
no.
Okay.
And that's what I think that we are still seeing them push a little bit more of a size component at
Yeah. She won
qualifiers.
the New York Pro last year, right? I
Who?
think so. What's her name with the pink in the pink suit, dark hair? I can't think of her name.
Um, Maria
Hmm.
Diaz. I forget what she won. She's got a beautiful shape. She's on the bigger side. And then
She is
Kaylee
very big.
Kaylee
Just
Bowman.
beautiful.
Yeah, she's stunning. I love her shape. So
Yeah, beautiful shape. Just she has that height, so she just needs, I think, a little bit more
yeah,
size to kind of make up for that height.
here's your top four. I was really impressed by Maud, this black girl here. She was
Hmm.
stunning.
In the gold suit, beautiful.
It
And
was really a really good look. Um, so you can see my screen, right?
there we go. Yeah.
So one thing I'm excited about is Keon Pearson doing his open,
Mhm.
but he's against. It's gonna be interesting because he's against
Who else
Sampson,
is coming in?
Martin
Okay.
Fitzwater.
Who
So
won
you've got
last year? I think Martin won Prague last year, right?
I don't remember to be
Yeah,
honest,
I
but
think he did. I'm pretty
you've
sure.
got
Yes.
212 Olympia winner versus two in your top five Open Olympia.
Yeah, that's
Um,
definitely going to be an interesting.
so figure girls, some of these I don't recognize. Literally, Amanda, um, Keon's fiance is the only one from the US doing this show,
Oh, wow.
which I think is interesting.
And she's just made it like amazing improvements to her shape.
Yeah,
And I mean, I'm really,
Dorothy,
really interested to see how she places here. I hope she does very well.
she is going to do very well.
Yeah.
I don't know where exactly I'll have her falling, but you have Dorothane, who's an Olympian.
Hmm.
She actually, I think she's a rookie pro this last year and qualified. She's incredible. Um, and then Barbara, where is she at? What's her last name? She's
I think
Barbie
Jennifer's here,
Lifts
but yeah. Hmm.
on Instagram, and I absolutely, er,
Yeah, she's just gorgeous.
her shape is
It's
super stunning.
insane.
Adela is an Olympian.
Hmm.
Um, Jennifer is an Olympian. She's the one you like. And I like her too. Teresa, she looks just like Gabriella to me. Like I have a hard time figuring out who's who because they look
Hmm.
identical to
Yeah.
me. Like I can't tell who's who. And I think that might be the same Gabriella. But those are the ones that really stood out to me. Like a lot of these girls I don't recognize their names.
I know.
So I need to
I need to
go
go look on Instagram and stalk them.
yeah, I need to go do some research.
Hmm.
But I'll be really curious to talk about that next week and see kind of what the results are. And then uh yeah, it's gonna be interesting. I don't follow
You
men's
think
physique.
Keon's gonna win Open?
It depends. I think he could, very much
Yeah.
so. I think he's got a beautiful structure. But, realistically, it's kind of the same with like Missy and Figure. We haven't seen him next to open bodybuilders.
Yeah.
So he looks massive against the other 212 guys, but how is he going to look? But
Against
I
300-pound
always,
Samson.
right, I always think of like Sean Clarita though, because Sean Clarita is not big and he
Yeah.
can beat a lot of these guys in an open show.
Mhm.
Um, and so we'll see.
I think Sean
I
Clarita
do
didn't he?
think
I think he did
Keon,
the Open in Mexico. I think he
hmm
got like third or fourth.
yeah, he did not place as high
Larry?
as I thought,
Yeah,
but I do think Keon will beat Samson.
you do. I
Hmm
actually don't. I don't. I think it's gonna. I think Samson's gonna win, and I think that because they're so aware of what happened at the Olympia, and that I feel like had he been filled out for like two more, like I think they just pushed that conditioning too hard, and I
That's
think if he
fair.
had been filled out, that
That's
that would be
fair.
the winning physique.
If Samson shows up at his best,
Hmm.
yes. If Samson shows up the way he showed up at the Olympia, no.
And he's had a good amount of time to like feed up for this, so it's gonna be it'll be very interesting.
Hmm We'll
They
see.
both have incredible shapes. I
It'll be
kind
fun
of
to
root
talk
for
about.
Martin too, just because he's like, I feel like he's always like the underdog, like he's always like that third or fourth place, and I don't
Yeah.
know. I
He's
like to root for
definitely
the
moving
underdog.
up in the ranks.
Hmm.
Like he'll be one to
Well,
contend
I do
with.
think he did win Prague, so he'll probably be top five at least.
We'll see. And there's Sean Clarita from last time. So, and yeah, Martin won last time because he's on the banner.
Hmm.
So, very, very cool.
Good one.
Well, I've got to hop off. I got a call, but
Okay.
let me
Well, have a
stop
blessed
sharing.
rest of your week.
There we go. Ooh, my face was really big. I don't know if you can tell, but my hair is actually pink.
I could tell in, I think one of your, I was like, is her hair like more beigey or something? Like, what is going on with her hair? Oh,
Well,
did you do it pink?
it is like a I
Like
told her I was like,
blush?
I want it so light of a pink that people question, is your hair pink? And that's exactly the question I'm getting. Like, is your and it soaked up more where my hair is super blonde than it
Mm-hmm.
did. But I don't know if I like even if it's not pink, if I like this like muted blonde or the platinum better. I would love your opinion as a hairstylist because I don't know what I like better. But I'm due for new
I,
extensions in
it's just a
November, so
different look. I probably would need to, you need to send me like pictures of you, like a head, like a selfie of just like your head. Like, I do like it because like this, it's sort of toned down. And like in the Instagram pictures and stuff, it's like reading as that it was toned down from like that kind of more raw blonde.
right.
So I
Like it
do
was definitely
like that, but I
platinum.
also think it might make your face be a bit more pink.
Yeah,
Do you feel like blushier in the face with this?
that's probably not going to do anything,
Mm-mm.
but I'll send it to you.
You have to text them to me later. Yeah.
I'll send you this and then I'll send you I don't have makeup on in this picture, but I look more red because I had just gotten out of the tan in bed. But I
Hmm.
um I don't know if this like more of a darker blonde because you get blonde blindness. I
Hmm.
don't know if I was just blonde blind and just actually like really really
Hmm.
blonde and too blonde or if this more of a natural this is easier to maintain for me, but
Yeah, exactly.
I
Yeah.
want whatever's prettier. So,
I mean, I truly like, if I thought one was better over the other, I would tell you that. I think this is great for summertime and for stage, this, because it's obviously has more pop, whereas like this is better for like your life.
yeah, I can
And
do
just
like a
like,
fall blonde and a summer blonde.
yeah. I did my hair blush pink maybe it was, I don't even know how many years ago. It was like 10 years ago. And I loved it. I loved it. And then I saw myself in a picture and I was like, that does not fucking look good. I was like, I have got to get my hair back. I got to get this off my hair immediately. But no, I do like it. I like it like this too. I like both. I truly do. And I think they both look good on you.
Thank
I
you.
think this is just like, it's funny that you said that because I was in the Instagram pictures. I was like, is her hair pink? I can't
Yeah,
tell.
yeah.
Yeah.
So faint.
Yeah, but I love it.
Okay.
Yeah.
I really gotta go now.
Okay, have fun. Have a great day. I will
Thanks.
talk to you soon.
I'll upload this later today, guys.
Okay, good. Bye.
Bye.